Welcome to the Rim Break Rodeo. We hope this video helps.
You start by confirming safety. Tell your clinician what you take, your baby's age, and any breastfeeding issues. Once done, choose the pill type with them, progesterone-only pills or non-hormonal choices, because estrogen can reduce milk. Make sure to ask about infant monitoring and whether timing of doses affects milk. If the clinician approves, obtain a prescription and read dosing instructions so you can start the regimen immediately and confidently. You implement the regimen, set an alarm, and take the pill at the same time every day to maintain steady levels. For progesterone-only pills, stay within the recommended 3-hour window. This keeps effectiveness and minimizes disruption to milk. Keep a simple log of feeds, infant weight, stooling, and any unusual infant symptoms so you can detect changes early. Once you have a pattern, make small adjustments only with clinician guidance to protect both effectiveness and supply. You finish by monitoring outcomes closely. Check milk supply, infant weight gain, and any side effects over the next 1 to 2 weeks. If supply decreases, intervene immediately with lactation measures, increase pumping frequency, offer extra pumping after feeds, and use skin-to-skin contact. Consider approved galactagogues with your provider. If problems persist or the infant shows worrisome signs, pause the medication only under medical advice.
Thanks for watching. Consider subscribing if we helped you.